It's my feel-good breakfast show.
Welcome back. It is your feel-good breakfast show, Expresso on S3. Now, this week, from the 5th to the 9th of September, South Africa celebrates National Kidney Awareness Week and focuses on the function and health of kidneys. Now, kidneys are very important as any other vital organs, and the consequences of not looking after them can be severe. Now, nephrologist Professor Nikki Wern and Dr. Craig Arendse are with us this morning in studio to chat about kidney health. And if you perhaps have a question for Professor, our doctor, please send us a voice note. That number is 063 408 8863. Good
Nikki,
morning.
Kay, good morning.
Good morning.
How are you guys doing?
Yeah, we're great. Thank you.
Thank you for being here, and I'm so excited to get educated and as well as educate Mzansi. But let's go straight into it. What are the kidneys? Where are they? Where is it located? And what do they do? Nikki, maybe I can ask you.
Okay, so the kidneys, firstly, they're located in your back, so
Yeah.
the back of in your abdomen.
So those kidney shots are
Yeah.
actually kidney shots.
They
it actually
are,
hits
they
the
are
spot.
actually kidney
Okay.
shots, and then and they have actually multiple functions. So they're very clever, our kidneys. They actually get rid of all the waste in our body,
Okay.
particularly important for getting rid of salt. And salt is also a big problem because if we can't get rid of it, it makes us more prone to getting high blood pressure. And then it has some actually really interesting functions. It actually helps produce hemoglobin, which carries your oxygen around the body. It helps produce vitamin D, which is important for your bones. So it's quite an important, yeah.
Very important organ.
Yeah.
Well, Dr. Arendse, I'm going to ask you, we have two kidneys, but we can survive and function with only one. Why is that the case?
Right. Good morning. Thanks, Zoe, for that question. So, yes, we all should have two kidneys, although in a small percentage of people, many people are actually only born with one kidney. More or less 5% of the population, one could say.
Sure.
And it's really important that you have two, because two is always better than one. But more importantly than that is that, these two kidneys function as a reserve for one another. So if the one fails, the other one can do the work that the other would have done. And probably more importantly is this whole concept of being able to donate a kidney, right, which we can talk about, a transplantation. And, one can donate a kidney and live without one kidney and live with just the other kidney for an entire lifetime, and be an altruist and donate that kidney to a potential or a person who might need, who might be on dialysis and need a transplantation. So having two kidneys somehow was designed phylogenetically by the higher forces to serve a purpose that we are now beginning to realize is important for humankind.
Well, Craig, I mean, having one or two, they both sound equally as important, right? And I would imagine health is obviously important to keep them functioning. As Nikki just mentioned, they're quite essential in our sort of functioning. What then would be the sort of, let's call it do's and don'ts when it comes to kidney health? I mean, it's definitely something you want to maintain as one of the healthiest organs in our body to keep functioning, right? But
Yes.
what are some of those do's and don'ts when it comes to health of kidneys?
All right, so, this being Kidney Awareness Week, I think probably the biggest message in all these health awareness periods is for us to become aware of what the kidneys do, first of all.
Yeah.
And then secondly is for us to become aware what the kidneys do, and especially the signs to look out for when the kidneys are no longer working that well. I think we all are very aware of our kidneys because we all pass urine. Right, and that seems quite intuitive that people have an acute awareness of having kidneys, but you may only really become more aware of it when something goes drastically wrong. And the obvious ones are when you stop passing urine, or when you pass urine that looks slightly abnormal, for instance, if there's blood in your urine. And those are just the very obvious signs, the obvious signs that something is wrong with the kidney. And that's obviously one of the first reasons why people suddenly become aware of their kidneys. But there are more reasons than that to be aware of your kidneys, and more reasons than that to be looking after your kidneys well in advance of disease. And that's probably where we need to have more education, teaching people that, once you're reaching your adult age of, say over 40 or 50, And more in particular, as mentioned earlier, if you have comorbid diseases like hypertension and particularly diabetes as well, you know, those two conditions in particular and a range of other conditions, you have to be more conscientious about your kidneys, even when you're passing urine normally, and even when you don't particularly feel unwell about, you know, your condition, you need to go to your doctor, have some very basic blood tests and urine tests done, and with those very simple tests, we can tell you whether you are at risk at least of having kidney disease. You know, the danger of this all comes to the fact that somewhere along the line, if you're not well aware of what can happen to you, you're going to end up possibly on with kidney failure, and that is a very difficult road to travel.
Yeah.
You know, having to be dependent on treatment modalities which we call dialysis, and then having to be listed for the potential of a kidney transplant. And those are really, those are available in South Africa. That's the good news. But unfortunately, you know, as Professor Wern will tell you, working in a state sector hospital, it's not available to just everyone who needs it. And unfortunately, that's the reality of living in a country where, you know, there are resource limitations.
Yeah.
And those kind of limitations make it very dangerous if you're not aware of what is going on in your kidneys.
Okay, well, this is exactly why we're having these conversations, because between the 5th and the 9th of September, it is National Kidney Awareness Week. We have the Prof and the Doc here with us. If you have any questions for them, please send them through on WhatsApp. We will be unpacking some of the common kidney diseases as well as so much more with what's to come. So send us a voice note. That number is 063 408 8863.
It's my feel-good breakfast show.
Yes, Mzansi, welcome back. Your Feel Good Breakfast Show, and we are carrying on with all the good stuff as our two professionals and specialists are in the building. And of course, this week is National Kidney Awareness Week, and according to the Association for Dietetics, I hope I pronounced that correctly, in South Africa, those suffering from hypertension, diabetes, obesity, anyone that's maybe even overweight should possibly pay special attention to how the conditions may affect the kidneys. Now, we've got nephrologist Professor Nikki Wern and Dr. Craig Orense in the building once again, and they're still here to chat to us about kidney health as well as how to cope with kidney disease. So, of course, for you, Mzansi, if you have any questions for our panel of experts, then come through on the WhatsApp voice note line, and that's 063 408 8863, because we are here to serve you.
That's right. Well, Professor Nikki, I'm going to start off with you. When it comes to the common kidney diseases that you get, what are some of the common ones and what are some of the symptoms?
Okay, you actually mentioned some of the common ones already, and in South Africa, our commonest ones are hypertension, diabetes, and then we've got this like range of glomerulonephritis, which is actually inflammation of the little filtering units of the kidney. And I just want to say at this point that unfortunately the kidney doesn't say I'm unwell until probably 75% of your kidney function is lost.
Oh, wow.
So this is why we want to be making everybody aware, because it's actually about going and getting yourself checked out before you have symptoms, because 75% is a lot. And often we can't bring you back from that. So the important thing is to check that your blood pressure is good, your sugars are okay, and if you do have high blood pressure and diabetes, that you actually manage them well. Now, this like interesting group of glomerulonephritis or glomerulonephritis is a bit more tricky, but the way we can pick them up is actually by going to your GP and making sure that we've got a dipstick in our urine and make sure that there's no blood or protein in them. They're the tricky ones because a lot of people do not know that they've had it. And then they go to end-stage kidney disease and actually have already lost their kidney function before they're actually detected. Wow. So that is a very concerning thing. And then other causes are that there are some genetic causes that often run in families, but not always. And then a couple of other important ones are kidney stones. So if you've got a family history of kidney stones, just to keep an eye out for that. And then there's a whole group of kind of urological or bladder problems that can also cause kidney failure. So it's quite a wide spectrum
Quite
of
a wide
diseases.
spectrum, but it does seem as though prevention is definitely better than cure
Prevention
in
is
this instance.
definitely the cure.
Craig, maybe I'm going to ask you then, let's say hypothetically the symptoms are already showing and we are 75% into the issue already. What are our options then when it comes to, let's say, treatment, or how do we prevent this or cure these issues? Is there any option for us?
Yeah. So that's a very good question. So the important thing to remember is that, as Nikki alluded, one of the most important things is to treat the cause of what is causing the kidney failure very well. So one of our most important jobs is to treat diabetes very well and to treat hypertension very well. And in treating those conditions, you are treating the kidneys, right, in preventing them from having damage from those diseases. So it's not always, our patients always want to know, doctor, what are you giving me for my kidneys to make my kidneys better? And yes, there are very specific drugs on the market that target kidney function and that can improve your kidney function specifically. But by and large, these are drugs that are related to other chronic conditions. And if you can optimize those, then you can improve your kidney function. The other the aspect of kidney disease is that we need to be able to monitor the kidney function very well through its stages. And the important reason for doing that is because at different stages of your kidney disease, you have different treatment modalities that become either relevant or in other cases irrelevant, and you have to possibly stop certain drugs that you initially would have started with, but later on become detrimental to your health. And then, of course, as we said earlier, once you've reached the last stage or the end stage of your kidney disease, hopefully not for many years, but once you've reached the end stage, then unfortunately, the main form of treatment becomes dialysis treatment, right? And we have different forms of dialysis treatment. We have the type of dialysis where a patient comes into a dialysis clinic and spends about 3 or 4 hours on a dialysis machine every second day of their life.
Oh, wow.
Sure.
Right, and that's a huge undertaking for a patient and a huge life-changing set of circumstances to the patient and the family, not to mention the expense that those people go through, to spend all this time on a dialysis machine. We also have options of treating your kidney failure at home with a modality which we call peritoneal dialysis. Right, and that is a very attractive option, something that we can roll out a lot more than these, dialysis clinics where you have to sit on these machines that cost an enormous amount of money. But that is the type of dialysis you can do at home in the comfort of your own environment, and it's actually a very effective form of therapy. And I know Professor Wayne and myself, we are both very interested in getting more people on peritoneal home-based dialysis. And then lastly, of course, kidney transplantation.
Okay. Wow. Well, I'm glad that there is at least some form of a solution to any of these issues. So you're not on your own, Mzansi. And of course, don't forget, the specialists are going to be going through a lot of these questions and a lot of the education when it comes to our kidney health. So come through with those voice notes. We'd love to dive in and have a conversation with you. They are here to serve, of course. So in the last part, hopefully we can hear from you, Mzansi, and serve you. But for now, let's find out what you have to say about any life-changing issues that you've maybe gone through yourself.
It's my feel-good breakfast show.
Yes, Mzansi, welcome back. Oh, I'm loving this conversation, and we're going to continue with just that. We are discussing kidneys as we bring awareness this National Kidney Awareness Week to you, Mzansi. Now, did you know the following, that hypertension actually affects approximately 25% of the adult population, and it actually is the cause of chronic kidney failure in 21% of patients on renal replacement. Now, apologies, I think my mic is just cut off, so I'm going to ask the assistants of Zoe to take over from here so that you can hear everything that is so important right now. Apologies.
Of course. Now, we have asked you for WhatsApp voice notes, and we have Professor Nikki Wern and Dr. Craig Arendse with us in studio, and they are here to chat about kidney health. Now, we've asked you to pose any questions to our experts, so please, let's take a listen to the first one that came through from Charles.
Good morning, everybody. Good morning to Expresso team. I'd just like to ask the doctor, can kidneys cause your urine to burn, or is it only like a bladder infection or something? I'd just like to get some more info on this, please. Thank you very much.
Thank you, Charles. So Charles wants to know, if if it's the kidneys that can cause urine to burn, or is the bladder involved?
Okay, so thank you, Charles, for giving us that question. So actually, when the kidneys are, your urine is burning when you pass urine, at that point it actually is down in the bladder. But the concern is that the infection can travel up from the bladder into the ureters, into the kidneys, and then we can get a condition called pyelonephritis. So they are connected. Warning signs are when you have that burning urine that it's probably in the bladder, but the concern is if it moves up into the kidneys, and then what we tend to experience is more flank pain in the back. Often associated with fever and feeling quite unwell. So yes, the two are, and if it gets to that point, it's really important that you seek medical care. I mean, even if you get burning urine, it's important to actually ensure you get that checked out.
I definitely think, I mean, in that instance, you definitely want to get checked out regardless, because there is definitely a concern. We've got another voice note coming through, of course. Thank you again, Charles, for that one. This one is from Gail. Let's hear what she has to say.
Good morning, Morning Expresso team and doctors. I have lupus and antiphospholipid syndrome. I have stage 3D kidney failure. And I haven't been given much hope by the doctors. They say there's nothing they could do. I go to a government hospital. There's nothing they could do for my kidneys. And I can't have a transplant, neither can I have dialysis. Doc, what do I do? And what more can I expect from this? Thank you.
Oh, wow. Gail, thank you for sharing. Doc, do you want to take this?
Yeah. So, Gail's condition, which she alludes to there, systemic lupus erythematosus, is a very unfortunate condition that does unfortunately affect predominantly female patients, and unfortunately also affects them in virtually the prime of their lives. And it's a condition that causes inflammation throughout the body. Unfortunately, it can affect the kidneys in a very dramatic way as well. Now, she sounds very down and dejected about it, and unfortunately that is the case in some very bad condition, in some very forms of lupus erythematosus. But, this is a condition of inflammation, and so she would have been offered anti-inflammatory treatment. And as we've said before, the other conditions that also contribute, like hypertension, also comes into that, and we often use some of these antihypertensive treatments to reduce not only the pressure within the kidney, but also reduce inflammation in the kidney. And in so doing, we try our very best to drag more and more life out of that kidney by reducing inflammation, pressure, and infection.
Okay.
It's not all doom and gloom for our lupus patients. We try our best. We run at Grooteskier, we have a very dedicated clinic that looks after those patients. And it's probably one of the biggest fields of research at this point, where we're looking into very targeted therapy to target that inflammation within the kidney, hoping that we can isolate the kidney inflammation without causing damage to the rest of the patient, in layman's terms. But lupus patients shouldn't really give up hope. The important thing is be aware of it, be aware of your condition, follow the rules and the advices put out by the doctors. And probably one of the most important things in those patients is very close follow-up with the doctor. We run a lupus clinic where we see these patients, I think, almost every third or fourth month or so. And, keeping a very close eye on her condition, that blood pressure, and what is happening in a medication and so forth is a way of getting more life out of that kidney.
All right. Well, I can't thank you enough, Nikki and Craig, for the incredible conversation we've had this morning, for bringing more light to kidney awareness this week, especially. I think it's obviously clearly so important. And for you, Mzansi, I hope you enjoyed this conversation too. Of course, seek any medical help that you can if you find any of these symptoms occurring with you. Hypertension and everything else that we've listed, it does go on. And of course, don't just sit there, don't wait. Prevention, of course, is better than cure. So again, thank you all. Have an incredible day. And Mzansi, I hope that this was something that could shed some more light on the situation. Here's to Kidney Awareness Week, and here's to your health.